Here we go. Hi, everyone. Again, my name is Terry Bearden, and I am the project director for organizational capacity building here at the National Community Action Partnership. Welcome to our webinar, which is Workplace Violence Prevention and Preparedness. Again, thank you for joining us. As you know, we always like to start our sessions with you by reciting the community action promise. So if you would like to join me at your seats in kind of grounding ourselves in the promise of community action. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. All right, thank you. So I'm now going to turn the webinar over to Rachel Sams, who is with our partner organization, Nonprofit Risk Management Center. So Rachel.
Wonderful. Thank you so much, Terry, and hello, everyone. I'm so glad to join you today to talk about workplace violence, how to prevent it, and how to prepare if it does happen. Before we, dive into today's content, I'd like to, give a heads up. Since this is a webinar about workplace violence, the presentation will touch on issues like assault, harassment, and mass shootings. So be sure to take care of yourself. We won't spend the whole time in dark places. We'll focus on practical steps that nonprofits can take. I wouldn't have created this webinar if I didn't think there was hope. But we will touch on some heavy issues. As Terry mentioned, this session is being recorded, so if you need to step away and come back to this another day, or listen to this webinar outside in the fresh air, or do anything else to take care of yourself during this time, please do so. Now here's an overview of what we'll cover in our webinar today. We'll discuss where workplace violence can stem from and potential sources of conflict. We'll talk about how to know the warning signs and make a plan, how to de-escalate conflict and respond to violence if it happens, and we'll share some tips and takeaways. We have some time set aside for Q&A at the end of the presentation, but you don't have to wait until then. Feel free to share questions and comments in the Q&A at any point or in the chat, and Terry will help me flag those. Now we'll begin to dive in to where violence can come from in workplaces. Violence can surface in our workplaces in a number of ways. Maybe two or more employees get into an argument. People your nonprofit serves might argue with each other or with one of your team members. Or maybe conflict happens between an employee and a third party, like an angry family member or spouse. Hopefully, if this happens, the people in conflict can resolve the incident peacefully and maybe even learn some strategies for future conflicts. But as nonprofit leaders, we can't just hope to avoid workplace violence. We are living in a world full of conflict and trauma, and every nonprofit faces the possibility of workplace violence. Unfortunately, many workplaces are not prepared for that possibility. More than 50% of HR professionals don't even know if their organization has a workplace violence program, according to the Society for Human Resource Management, or SHRM. As nonprofit leaders, we must understand the risks, work to prevent violence if we can, and have a plan to respond if prevention efforts fail. And of course, we need skills to deal with workplace violence because we are living in a very stressed society. Hate crimes are rising and mass shootings are trending upwards again, unfortunately, after decreasing in 2022. And as the stress of the COVID pandemic increased, many nonprofits faced new pressures. Our organizations seek to make the world a better place, and people in need often turn to our teams for help. Many nonprofits that NRMC works with are seeing more internal conflict on their teams and more confrontations with clients or members of the public. In the most extreme scenarios, those kinds of confrontations can lead to workplace violence. We'll start today by sharing some data about workplace violence to help us understand the problem. This is arguably the heaviest section of our webinar, but it's also the shortest. After this brief overview, we'll talk about practical steps that nonprofits can take. We know that there were 392 workplace homicides in 2020, and that's the most recent data we have from the U.S. Bureau of Labor Statistics. What do the trends in workplace homicides tell us? A joint study on workplace violence found that workplace homicides declined by a total of 58% between 1992 and 2019. However, that study by 3 federal agencies also noted that workplace homicides rose 11% in the last 6 years of the study period. Homicide comprised about 20% of all workplace fatalities for women in 2019, compared to 7.5% of workplace fatalities for men. On average, American workplaces experienced more than 1 million non-fatal violent crimes each year between 2015 and 2019, according to federal data. That includes rape or sexual assault, robbery, aggravated assault, and simple assault. The number equals 8 non-fatal violent crimes for every 1,000 workers aged 16 and older. And unfortunately, workplaces are also the most common site of mass shootings, according to the Violence Prevention Project Research Center. When workplace violence does happen, it can have long-term consequences for survivors and the organization. Survivors face physical issues that can range from injury to temporary or permanent disability and higher risk of health issues like hypertension, according to the National Safety Council. Survivors might also experience psychological issues like post-traumatic stress disorder or PTSD, trouble sleeping, sadness, fear, and anxiety. Survivors can face financial consequences like medical costs, lost wages, and running out of sick leave or PTO. And they might experience social consequences like isolation and troubled relationships with friends and loved ones. And for a nonprofit, workplace violence can result in employees leaving the organization. It can result in absenteeism, tardiness, and sick leave, and it can mean less ability to provide services. The National Institute for Occupational Safety and Health estimates the annual cost economically of workplace violence at $121 billion. Now that we understand more about the scope of workplace violence, let's explore how our nonprofits can help prevent it. And Terry, I want to pause for a moment and see if we have any questions coming in so far that we need to address. This is also a moment where people can think and type if any questions are coming up already.
Not yet. Everyone's doing a great job of entering their name and agencies and locations in the chat, but I haven't seen any questions come through. I don't
Okay.
see any hands raised yet, but please feel free to raise your hand or enter your questions in the chat.
Fantastic. Thanks, Terry. Let's talk about what our nonprofits can do to understand and try to prevent workplace violence. How do you know if an employee or client or someone else involved with your nonprofit might be moving toward violence? These are some warning signs from the National Safety Council. And these are not absolutes, but they are things that if you see them, you want to keep an eye on them and take a closer look. And we'll talk more about how to do that as we get into this section of the webinar. Those potential warning signs include an employee or another person on your premises or working with your nonprofit making direct or indirect threats, a person having a history of violence or criminal behavior, verbal abuse, unpredictable or menacing behavior, being uncooperative with peers, preoccupation with weapons, offensive comments or jokes about violence, and drug and alcohol misuse. There can also be specifically job-related warning signs that can be an indicator that someone might be moving toward violence. And those can include disregard for health and safety, frequent and unexplained absences or tardiness, difficulty concentrating, inconsistent work performance and attitude, excessive need for oversight and supervision, a decline in work performance, and poor health and hygiene. Of course, workplace performance and behavior issues can happen when someone is just going through a hard time, whether they have violent intentions or not. If you see any of these signs from an employee, it's important to check in with them and ask what they need. The best option might be to remind the employee that they can get support from your employee assistance program or other resources in your community. We encourage folks to talk to their HR teams if they need support. And if you're working with an organization that doesn't have HR, speak to a member of your management team. And I believe we had a hand raised. Was there someone who had a question?
Don't see the hand raised right now. If you had your hand raised and you put it back down, would you raise it again, please? Or come off mute and ask your question. Okay, maybe it'll come back to.
Sounds like we're good for now. Okay, thanks, Terry. Again, important to remember to check in with your HR team if you see any of these signs from an employee. And if you don't have HR and really need another perspective, we encourage you to talk with a member of your management team. If you're on the management team, that might mean a trusted peer there. If you're not on the management team and you see signs that concern you, that might mean talking to a supervisor. And it's also important to remember that while violence often follows a progression, it's not always linear. Every person and every situation is unique, and risk factors for violence should never be ignored. So now that we know some of the potential risk factors for violence, let's talk about how to create a prevention plan if your organization doesn't already have one. A strong workplace violence prevention plan can make employees feel safer and encourage them to report risk factors for violence. Prevention plans can also lead to higher morale, lower insurance costs, and a stronger organizational safety culture. Some ways to get started on that effort. If your nonprofit is large enough, consider asking for volunteers for a task force to create your plan. No matter what size your nonprofit is, ask all of your team members for input early on in the process. And make sure to prioritize the feedback you get from the people who do your nonprofit's most high-risk jobs. If you don't know what your most high-risk jobs are, that's okay. The next couple of slides can help you with that. I also want to note here that many states require some types of workplaces to have violence prevention plans. And there's also a bill before Congress that would require OSHA, the Federal Occupational Safety and Health Administration, to create a standard that requires health and social service employers to have workplace violence prevention plans. The National Safety Council has identified some factors that can make it more likely that a workplace will experience violence. They include environmental factors, like a lack of natural surveillance. Another way to say that is, can you see easily and hear what's going on? We encourage folks, if they tend to provide client services in isolated rooms that don't have windows, to change that arrangement so that services are being provided in environments where other team members can see and hear what's happening. Other environmental factors that can increase the risk of violence include blocked entry or exit routes, poor lighting in areas like corridors or parking lots, an unstable political or social environment, high crime rates in an area, and working in or near establishments that serve alcohol. There are also some organizational culture types of factors that can influence the risk of violence. And they include situations where violence is almost accepted as just part of the job, and employees may fear being retaliated against if they report it. Other organizational culture factors that can increase violence risk include when there are chronic disputes between management and employees, frequent grievances filed by employees, or a perception of injustice, unfairness, or double standards in the workplace, chronically dangerous work conditions, frequent injury claims, especially claims for psychological or occupational stress, understaffing or a high demand for overtime, and low employee engagement results. And these here can also include HR grievances or stressors or high conflict. Those might be signs that you would see on an employee engagement survey that would indicate a need for concern. There are occupational factors particular to certain types of jobs too that can increase the risk of violence and a need to take additional safety measures. Those include prolonged or irregular shift work, working alone in isolated locations or a patient or client's home, public-facing work, especially in service professions, working with people who display volatile or unstable behavior, working with people with a history of violence or substance misuse, working in community-based settings like rehabilitation centers and group homes, handling cash and valuables, and delivery of passengers, goods, or services. So we encourage everyone to review your workplace for those risk factors we just listed and create a plan to address the most significant risks you find. You may find that you need to work on making your nonprofit's physical space safer. That might include adding more lighting, removing anything that blocks lines of sight, installing panic buttons, and clearly marking entrances and exits. As we mentioned, if you don't already, we really encourage holding client meetings in areas that are within sight and sound of other staff. Whatever changes you plan to make sure to get employee input and ask your team what else you could do to make them feel safer at work. Follow up on all the suggestions that you receive to let employees know what you changed, what you didn't change, and why. Training can also help make workplace violence less likely and prepare you if it happens. All employees should receive training about workplace violence issues at orientation, along with annual refreshers. Your training should describe the types of workplace violence. It should emphasize the responsibility that every employee has to share concerns about violence. It should also provide information about de-escalation strategies, which we'll talk about in a moment. It should let employees know how to respond in an emergency and how to report workplace violence. It's also important to remember that workplace violence incidents often happen quickly and end before law enforcement arrives. So for that reason, the FBI really encourages workplaces to focus on training that can help employees develop the skills and awareness they would need to survive in a fast-moving situation. And managers and supervisors should receive additional training on how to recognize and respond to those potential signs of workplace violence. If an employee faces stalking or threats from someone inside or outside the workplace, the National Coalition Workplaces Respond to Domestic and Sexual Violence recommends doing a safety audit. An audit can sound like an intimidating process, but it doesn't have to be. A safety audit focuses on things like determining how easy it is for someone to access employee premises and employee information, and then working to close any gaps you find in safety there, and using the information that you find to help mitigate and reduce those risks. It's also important to ask any employee who's being stalked or harassed what kind of support they need from your team, and give them as much of that support they request as possible. That's a trauma-informed practice, and it empowers an employee who faces a scary situation where they don't have much control. One of the most important things employers can do to reduce the threat of workplace violence is to create a culture that's anchored in psychological safety. If employees feel they can speak up about worries and concerns without retribution, they'll be more likely to help you identify workplace violence risk factors, and they'll be more willing to report problems so that you can address them before an incident happens. To help create that environment where people do those things, make sure that you don't punish employees when they make an honest mistake. That sends the message that you're open to things that can happen in a workplace and people sharing worries and concerns. And when people share differences of opinion, welcome those too. You might find that if you encourage that, people share things that you might not have thought of about risks to the workplace and how to make it safer. Before we move into the next section of our webinar, which focuses on those de-escalation strategies, I want to pause again, ask Terry if we have any questions in the chat. This is also a chance to type in a question if you have one. Terry, are we seeing anything there yet?
Nothing for you, Rachel. I do want to take this opportunity to apologize. We are in webinar mode, so if you do want to speak, I can recognize you, but you will need to raise your hands. And also wanted to let everyone know that the webinar recording and slides will be posted at the NCAP website, and I've provided that link to our resources page in the chat for everyone. So thank you.
Wonderful. Thanks for that clarification, Terry. We'll move into our de-escalation strategies now. So one thing that you might wonder if you haven't faced situations like this, or even if you have and you're thinking back on those situations, is how to know when you need to intervene in a conflict immediately. It's important to first observe the situation from a safe distance, if you can. Take a look to try and assess how heated the conflict is. Check in with yourself to see if you have the emotional resources and any support you need to respond. And take a second to consider, could you intervening increase the risk of harm? Once you've taken a look at those things, if the person's behavior or the situation is escalating and you think violence might take place, leave the situation, go to a safe location, and seek help. These are some warning signs that a conflict is escalating, which increases the risk of violence. The lowest level of conflict is agitation. That can involve aggressive body language, sighing loudly, and eye rolling. One thing to remember is that at times, some neurodivergent people might display gestures like eye rolling without any aggressive intent. The next level of conflict is escalation. That can include pacing, finger pointing, using an aggressive tone of voice, raising one's voice, or arguing. And peak conflict is the highest level. That includes verbal abuse, things like shaming, humiliating, or harassing someone, spitting or inappropriate touching or gestures, physical aggression, or the display of weapons. If you've evaluated all of that, looked at the situation, and you decide to take action to de-escalate conflict, here's what to do. First, take a few deep breaths to ground yourself before you act. Even one will help. That breath activates the parasympathetic nervous system, and it can help offset that adrenaline rush of fear, ground you in your body, give you that second to think before you make your next decisions. If you can, change the setting. That could mean removing onlookers from the area. That could mean asking some of the parties in a conflict to leave. It's really important, if you attempt this, to respect personal space, maintain a safe distance, and do not touch the person who's upset. Probably the most important thing you can do in a de-escalation situation is to listen. Give the person your full attention. Nod at what they say. Ask questions when you can, but don't change the subject and don't interrupt. Empathize. Show genuine concern and don't say anything that could be interpreted as judging a person. And speak slowly and calmly. Monitor the volume of your voice. Do not raise your voice. And avoid emphasizing words or syllables, which can escalate a situation. These steps can often help stop violence in its tracks. But if violence does occur at your nonprofit, your leaders should follow your emergency and evacuation plans, as well as your guidance on when to call 911, and follow all your organization's procedures on reporting and investigating the incident. Here's what to do immediately after an incident of violence if one occurs. First, make sure all your employees, your clients, anyone who is on your premises, vendors, partners, make sure everyone is accounted for. Provide first aid or get medical attention for anyone who requires it. Inform your employees what happened and let them know what actions they need to take to stay safe. Immediately make counseling services available at no charge to employees. And provide longer-term support for employees as needed. That might include additional counseling, medical care, financial or legal assistance, and extra time off. If a very severe incident of violence occurs, you might need to take additional steps. You might need to create a return to work plan with employees who need time away from the office to recover. Stay in touch with thoughtful cards, occasional check-ins, and visits as the employee feels comfortable. You want to show that you care and that you're concerned about them, not create pressure. As the employee's return approaches, consider any job modifications they might need to come back to work. Depending how severe the incident was, your team might need more help to process what happened. You might need to have a conversation facilitated by a mental health professional. Or if a coworker died, you might need to hold a memorial service for that person. Reach out to family members of any employee who is injured or killed to show that you support them. And follow your crisis management plan to communicate with outside parties like the public, donors, and clients as needed. One encouraging thing I want to make sure to share is that if an act of violence occurs, studies have found that social support in the days, weeks, and months following that incident can make it less likely that the employees affected will experience depression. Social support can include expressing care and concern, providing concrete support like time off and flexibility in work hours and location, and just listening when employees share their experiences. If violence occurs at your organization, whether you witness the incident or not, it can be emotionally challenging to support your team. You might want to stop talking about what happened as soon as possible, but the consequences of violence can stay with teams for a long time, and all of you can heal better if you acknowledge what you're feeling. Make sure to start with yourself. It can help to write down your feelings, no matter what they are. It's very important to get enough sleep and eat well so that your body has the time and sustenance to process what you're feeling. And name what you're feeling with your team. That can help show them that it's okay to experience a range of emotions after what happened. If a member of your team who saw or experienced or was a bystander to a violent incident shares something they're struggling with, make sure to listen, ask them what support they need. If they don't know what they need, suggest a few options and see how they respond. It's okay to come back to the topic later. And just make sure, first and foremost, to let them know that you care and that you're concerned. I have just a few final tips and takeaways to share, and then we can jump into some Q&A. Just the very most important thing I can say today is that safety comes first always. That's the safety of your team. It's also your safety. When something happens at your organization, you won't always have more than a few seconds to react, and you might have very little information to make your decision about what to do. First and foremost, trust your gut. If your gut says it's not safe to try to resolve this, don't. Leave the situation and get help. I also want to encourage you to feel strong in your knowledge as you gain more knowledge about how to deal with workplace violence. If you know de-escalation techniques, you might not have a chance to use them in every situation, but just knowing them can give you that additional confidence in those quick moments when you have to make a call. And all of your actions matter, from attending this webinar today to how you meet conflict in the future. One person stepping in can make a difference. That difference could be as small as just reaching out to a coworker to say, hey, I see that you're going through something and I care. I want to see if you're okay. Or it could be as big as preventing a situation from escalating into violence. All of those things matter. I'll shout out a few resources that I've mentioned on this presentation, and you'll have these when the slide deck is shared afterwards. They include that toolkit from the Coalition Workplaces Respond. They include our NRMC webinar, which goes into more detail about conflict de-escalation at work. And we also have an article on how to create a violence prevention plan that also goes into more depth on that topic that I touched on today. So with that, I will invite you all to share your questions, thoughts, comments in the chat. And Terry, let me know what kinds of things you're seeing. And I have a few questions for you all if you don't have any for me, but I want to give you the floor first and see what you might want more information on or want to follow up on.
Rachel, so Marcy Hunt asked if they're able to share this with our organization. And of course, we're going to be posting the recording and the slides at the NCAP website. But I just wanted to give you an opportunity to weigh in on our members' abilities to share this information.
Oh, absolutely. I hope that you will share it with your teams and I hope that you'll discuss it with them. That might be a great way to get started. If talking about this with your team is new to you, maybe you could just begin by sharing the slide deck and saying, what kinds of thoughts and questions does this bring up for you? What areas do you think we could focus on to do more? I would really encourage that personally.
Thank you. All right, anything else? Any other questions? I don't know if people prepared for a quiz, Rachel, but go for it.
Well, I would love to know if anyone would like to share what topics resonated with them from this webinar, anything they are maybe thinking about differently or ideas for things they can do in their own workplace as they've just taken a moment out of their day to think about this topic and devote some time just to spend a half hour or so thinking about this.
I will share that Marcy said, thank you. We're working on this with CAPRW. So this is something that definitely our agencies have considered or started to consider. Who else? Who else would like to weigh in? It's talking about the signs of escalation were very helpful. About to go into a difficult meeting, and this helps tremendously.
Oh, I'm so glad to hear that. It can really, sometimes that feeling in the pit of your stomach when you're going into a situation where you think it might be challenging, you think there might be conflict. It can be really helpful just to have a few resources to rely on to feel like you have some information if that situation does look like it might escalate. So that's great to hear. Thank you for sharing that.
Jessica Petty says, thank you, Rachel. IACA is working on bringing information about violence prevention and disaster planning to our network. Any additional resources are greatly appreciated.
Oh, that's wonderful. It's great that so many of you all are already thinking about this. And if it's newer to you or if you're just getting started, it's okay to start small and take one step at a time. You can build on each thing you do. It advances you a little bit further down the road.
Here's another question. What is the best way to train or introduce the policy to eligible entities?
Yeah, that's a great question. If you can, I'll do my best to answer what I think you're asking, and feel free to ask for clarification if I'm not quite getting it. But a great way to start with your team might be to develop a training that goes through some of the things that we talked about today with what are the types of workplace violence, how can they report it, or how should they respond at your organization, what should they do in an emergency situation, and how can they de-escalate. It would be a great place to start might be to develop even a few slides or a brief video on that for your onboarding training. That could be a good place to start to make sure that everyone who's joining your organization gets that foundation. And then you could supplement that with annual training using those same resources for your team. And as you get it established, you would want to update it every year, maybe with new information and scenarios that you're finding.
Here's a comment and a question to the other attendees. In the past year, my agency has made the decision to have our doors locked and access is gained by clients or visitors ringing a doorbell and being allowed access. I've been here many years and it feels mean, though considering the changing landscape and experiences we've had that necessitated this move, it still feels a bit exclusive. Has anyone else experienced this?
That is a great question. I have some thoughts, but I'd love to hear if any other organizations want to share how they're dealing with this.
Don't see any comments. Oh, here we go. I heard you speak. Oh, this is on a different topic. Our organization is also closed door and doorbell access. Someone says, I heard you speak a lot about prevention and compassion. Thank you. I was hoping to hear more about lockdown procedures in general. Will there be an upcoming training on lockdown procedures? We are having difficulty identifying a device or silent alarm to alert employees in the building. That's a tough one.
Yeah, thank you for that additional feedback that more information about lockdown procedures would be helpful. We'll consider that for future trainings we do on this topic. I really appreciate that. One thought that comes to mind as folks are talking about the issue of locking doors and clients needing to buzz in or something like that to get access. I definitely understand the just the feeling that that's mean and that's maybe not inclusive and not the message that you want to be sending. Some potential ways to communicate with your constituents about that might be to say, we've taken this step for everybody's safety, including the safety of our program participants. And also, that's a great opportunity to invite feedback. Ask them, we want to keep you safe when you're here in our building. What measures do you think would be best for that? And that could, gathering that information, if you were even able to do a survey, that could be something that you take to your leadership. And ultimately, it could help move you into a situation where your community is co-creating those solutions with you. But I do understand that impetus to, you want to make sure your team is safe and you're taking the steps that you can by locking the door to do that as a stopgap measure. Maybe that might be a way to move forward in the long term.
A couple of other folks said they also have locked doors. You have to ring a doorbell to get in at the administrative offices. The front lobby is open limited hours. Phone numbers are posted on the front door for access outside of those hours. Um, so yes, very similar, I think, processes going on in quite a few places. And I would agree with you, Rachel, that engaging the customers and giving them the opportunity to share their opinions and voice their opinions about our policies can be very helpful and can also really encourage buy-in for those procedures because unfortunately we all recognize the reality of the potential for violence, unfortunately. Don't see anything else. Any last minute questions or comments? Okay, well, with that, Rachel, I will thank you very much. I'm going to start sharing my screen while we thank you for your time. And I'm going to do a little bit of talking about some of the other resources that your organization has available um, for our members. Trying to do two things at once. So hopefully you can see my slides now. And again, we will share all of this information. I greatly appreciate your time, Rachel, and we will follow up with you if we get any other questions and hopefully have the opportunity to engage with you in the future further.
Wonderful. Well, thank you all so much for the great questions and helpful comments. And thank you for your attention to this topic. It's great to see how much people are working on it. Enjoy the rest of your day.
Thank you, Rachel. All right, so as we kind of wrap up the violence prevention and preparedness, I did want to share that one of the things we had a lot of success with in Arkansas when I was with the state association, as you think about how to put together your plans, was we reached out to local law enforcement. In some cases, it was our local police departments. In other cases, it was our sheriff's offices, or even the Arkansas State Police. And they were very helpful in terms of coming in and doing response training for our organizations, our Head Start centers, and our agencies. So that might be just another thought to place in your minds in terms of what we found to be effective. And it was another way to to build some strong relationships with our law enforcement agencies as well. All right, so we heard from Rachel and we got some great information from her, but we would be remiss if we did not take just a few minutes to talk about the wonderful organization that is Nonprofit Risk Management Center. To say they're a multifaceted organization is really putting it mildly. Some of your organizations may have engaged with NCAP in the Pathways to Excellence program, and so you have completed an organizational, thank you, Mary Beth, an organizational assessment as part of your pathways to excellence if you're in the silver tier. But they have more than that. They have so much more than that. Your organizations are required to conduct comprehensive risk assessments, and they have a very, very comprehensive risk assessment tool. It's important to recognize that community action agencies are provided with access to all of the resources that Nonprofit Risk Management Center has available as part of your member benefit, part of your benefit of being a member of NCAP. When you're thinking about the development of policies, there are templates for all kinds of personnel policies, risk management policies, just a plethora of templates that you can pull down and revise and customize to meet your organization's needs. And then they have information in their resource library that is just absolutely amazing. And I've gotten a little bit lost a couple of times in the website because I was trying to take a look at everything that they have. So I am going to start a new share here and just give you a quick view of what all is available. Here are some of their top ranked keyword searches. They have conflict resolution information, cybersecurity, HR, employee onboarding, employee retention, hiring and talent acquisition, HR tools, leadership, organizational culture. I mean, you name it. If it is something that is going to benefit your organization, there are probably resources that are available through Nonprofit Risk Management Center. They have searchable resources. There are some ways to really provide some motivational content to help nonprofit leaders kind of influence the culture within your organization, as well as empowering resources that can really help to leverage the opportunities and take bold mission advancing risks. And then I spoke a little bit about the risk management portal and assessment that we provide for our organizations. So the left column is that organizational assessment that agencies involved in the pathways to excellence have access to or complete. Then the sample policies we talked about, the risk assessment, the comprehensive risk assessment, as well as member benefits and portal tools, which is where you kind of manage the member access and account and user information for your organization. So again, I cannot stress enough just how impactful accessing these resources can be for your organization. So I would encourage you to really just take a deep dive into their website and see what resources can be helpful to your organization. So to wrap things up, there is a evaluation that we have created in SurveyMonkey, and I'm going to see if I can copy that. Mary Beth may copy that for me since she's on. As we mentioned, webinar recording will be posted in the NCAP resource library. I like to mention that that resource library is where we post the recordings of many of our webinars. So if you realize, oh, I didn't get to participate in such and such a webinar, I saw it go by in the e-news, but I didn't have the opportunity, check out that webpage, and chances are we have posted a recording of that information to you. And so with that, unless there are any questions for me, I will bring us to an end. Mary Beth, did you have anything you wanted to? There you go. Thank you very much. All right. Well, I appreciate everyone's time and attention. We hope this has been informative for you and kind of given you a place to take your plans and assess your risks within your organization Unfortunately, it's the place we find ourselves in, and the better prepared we can be for the potential of workplace violence, the stronger organizations we will have, and the better our relationships with our customers will be. So with that, if I don't have any other questions, I will thank you for your time and we will close the webinar. Thank you.